Let's talk about sciatica. Now, there's a lot of different directions to go with this, but first of all, let's talk about what is it. So sciatica is when you have compression of the nerve root going on. It's typically between L4, L5, L5S1. Those are the most common segments of which sciatica will typically take place, because your sciatic nerve actually it can come out of multiple roots, and then it's the nerve that comes down through your booty, right, and then down the leg. So a lot of times people will self-diagnose themselves with sciatica, or they'll go to their doctor and their doctor will be like, after describing the symptoms, the doctor will go, oh, sounds like you have sciatica. Unfortunately, sciatica is one of those that so easily and so commonly, it's not normal, but it's common, that people are told they have sciatica based off of their symptoms. However, sciatica is not something that is meant to be diagnosed off of symptoms. It is something that should be diagnosed through imaging. So typically you'll start with X-ray imaging. What they're going to be looking for is compression on those discs, which would lead you to believe that there's compression on the nerve root as well. However, really you cannot diagnose sciatica without an MRI, whereas think of like an X-ray as like an overview, right? And then an MRI is going to be the zoomed in view of the area. And that way you really have an idea of what's going on. There's some good news in this, because you also have this itty bitty little muscle that's known as your piriformis. And this muscle has the ability to cause sciatic-like symptoms. One of the best things that I do, or questions that I'll ask my clients when they're thinking that possibly they have sciatic symptoms, I want to know, does it start at the low back, does it go to the butt, does it go to the knee, or does it go all the way down to the foot? And if it goes all the way down to the foot, that is going to lead us more likely that it's a compression happening at the nerve root.